The variant first identified in South Africa pushed the country's hospitals close to the brink last month. Now the desperately needed rollout of the AstraZeneca vaccine is on hold. After early signs, it failed to prevent most mild or moderate cases, raising questions about how effective it is against severe cases.
We don't want to end up with a situation where we vaccinated 1 million people or 2 million people with a vaccine that may not be effective in preventing hospitalization and severe disease.
AstraZeneca was considered the best hope against the coronavirus. It's much cheaper than other vaccines and considered 100% effective against severe infection. Canada pre-ordered 20 million doses. That was before the emergence of more contagious variants.
This is clearly concerning news. However, there are some important caveats.
While the WHO is worried, it points out the new data from South Africa is incomplete. It was based on a small group of young, low-risk patients, so more study is needed. But Europe isn't waiting. Several countries are racing to stay ahead of new variants as millions of vials of the newly approved vaccine arrive.
We've seen the first data set, from real-life infection from the heat of battle in South Africa, saying it's got reduced efficacy against those mild and moderate infections, but the jury's still out on what it means for severe or fatal infections.
Researchers say reconfiguring vaccines to target new variants is not only possible, it could be done relatively quickly.
This is a huge feat when we look at how we were previously making vaccines. So we're almost able to keep up with the virus.
If vaccines fail to control the spread of new variants, the world could be in for a longer and more costly battle against COVID-19. Vic Adopia, CBC News, Toronto.